kind of to go through with this is it's not, I guess you're hearing a little bit more about it nowadays, but cortical visual impairment. And with that, I think we're talking about the eye versus the brain sort of thing, information processing. As far as the definition, the one that I kind of pulled off with cortical vision impairment, CVI, it's brain-based condition where the eyes see normally, but the brain has difficulty processing the visual information, which leads to reduced vision. So I guess the catch here is it's not because they can't see 20/20 because the glasses or the prescription is off. There's something that has happened, whether it be premature, whether it be an injury, a developmental issue or stroke, or something that's causing them not to see what we would consider 20/20 or good vision. There's something that's reducing that vision. And there's a lot of things, when you look under this, that actually could contribute, that could lead to what we call CVI. What do you think, study-wise? You got something specific on it, or what you got?
Well, it's...
enlighten us.
What causes this is a lack of oxygen or blood supply to the brain, basically.
Okay.
And hydrocephalus, when there's too much fluid on the brain, can cause this. Infections that reach the brain, head injuries, and certain genetic conditions. So it's not as rare as you might think. There are 180,000 cases a year in the United States.
Right.
Most docs, really you have to be either a pediatric optometrist or a pediatric ophthalmologist to deal with this syndrome. And the treatment of it, gosh, the symptoms are, they don't respond well to things they see. They see parts of things in front of them. They have trouble recognizing faces, and it's very hard to pin down, actually. Yeah. What you do is get a general eye exam first to make sure that it's nothing routine.
Right. Close to the spring breakers is getting a little more traffic in town, so sun, summer, sand, all that stuff. And for us here in Pensacola, that means certainly looking forward to seeing the Blue Angels too around July. But being out in the sun, that's what we're going to talk about today. Being in the UV light, wearing eye protection, which will help with a lot of things. And we're going to kind of go through certainly, whether it be brand name frames, whether it be the lenses, things that will help you. Because we get questions a lot, as far as patients who come in with certain, let's say it's a pterygium, and we'll talk about that, or just dry eyes, or maybe even cataracts. And they say, hey, hey doc, how do I have this? Could I have prevented it? And certainly sunglasses will do a lot of those things to help prevent the progression of some of those things, especially on the surface of the eye.
In evidence-based medicine, the only real correlation with things that are cataractogenic, in other words, they cause cataracts, are UV light. Everything else is all suspect to theory and not really evidence-based. And there's a lot of things with that, but these UV is a proven mutagenic to the human eye and the lens in the human eye.
And just like most things, we talk about UV light, UV rays can damage. It can be short-term or it can be long-term. We think about our skin a lot of times as far as putting maybe whether it be a sunblock or sun protection on the skin, but I think a lot of us don't necessarily realize that the eyes and the conj and the surface of the eye can get sun damage just like the skin can. So that gets neglected a lot of times. But we're going to go through, certainly the question I get asked a lot is, what sunglasses do I need? What UV protection do I need? If I go, whether it's a nice pair or maybe a cheaper pair, which UV protection? What do you usually tell patients as far as, if I need UV, what UV do I need to protect for, and that sort of thing?
Well, I get more specific with him. I customize it.
Yeah.
So if he says, I can't wait to get off work on Friday nights because Saturday morning I'm in a boat all day fishing out in the Gulf, well, that's a different program. That's intense. Ultraviolet light tends to bounce off. So there's different components of the spectrum to ultraviolet. Now, Dr. Bell's going to get, I have to watch because I tend to go in the weeds, okay? There's ultraviolet A, ultraviolet B, ultraviolet C, and ultraviolet D rays. So some of the cheaper sunglasses will only block A and some of B, and they won't do the whole spectrum. The real good ones will catch it all.
And we're talking about dry eyes. It affects, I mean, it really doesn't matter how old you are, environmental conditions, certainly autoimmune things. There's so many things, staring at the computer screen, there's a lot of things that feed into this. And then some people know that, don't know they have it, or they will come in with certain complaints and say, hey, I had this or had that, and not necessarily think or relate it to dryness or dry eyes. But let's start just basically with either one of you want to jump in. What is your definition of dry eyes? When a patient asks you, hey, what is dry eye syndrome or what is dry eyes, what would you say to them?
Dr. T?
Well, I got to think a minute. I try to talk in rigorous terms, but in this case, I will tell you that it's a general condition that has multiple etiologies, and it's a very difficult thing to diagnose, and it's characterized by many symptoms. So it can come from, there's different forms of it. Basically, the patient will complain that there's sandy or gritty feeling in the eye, or have difficulty with their vision blurring, or those are the two big ones that come to mind. Or they say that their vision fluctuates a lot.
Go through a topic that certainly women's eye health. Eye health in general, we talk a lot about on some of our other podcasts, but certainly with women, females, we're going to get into some things as far as maybe pregnancy, menopause, things like that. That's certainly how it affects the eye health and vision and a lot of other things that go along with that. Do you get that quite a bit as far as patients asking, or what would you say? Yeah.
Absolutely.
Yeah.
Maybe not necessarily about women's health and hormones in general, but it is often that problems or symptoms occur or are brought to my attention that are very much related to hormones and women in general.
Well, we've talked about certainly, and we'll talk about, I'm sure, in future segments, dry eye syndromes, dry eyes, and certainly women, I think, in general, I think it's a fair statement to say they're definitely possibly more prone to having dry eye syndromes, vision changes, eye discomfort based on a number of factors. I get the question a lot, hey, doc, I'm pregnant or I'm about to be pregnant, what to expect, how is that going to play out with my eyes? And I think a lot of times we cover the refractive and we'll say, hey, possibly during the pregnancy and even 3 or 4 months post-pregnancy, it could affect your prescription, it could affect your vision, and if it does, certainly we'll bring you back in and do another refraction after the fact. But there's things also during the pregnancy, gestational diabetes, preeclampsia, as far as those things. So those are reasons, and those are things we're looking for. Certainly, we're looking at the eye component to make sure the eye is healthy, to make sure there's nothing serious, but also to get you comfortable to treat these conditions, whether they're mild, moderate, or severe.
I personally have not had much complications. The ones that I've had a few of were what you said about the preeclampsia.
Yes.
And that's much more common than I knew about when I was in school. So, but in terms of refractive error, even though it's in the literature, it states that it's 5% or so. I hardly ever see that. I don't see that much. At all. No.
Lens Health Week coming up here, so we want to kind of get in. That's the topic for today is contact lens. Talking about, I guess, different brands, but also just care tips, ways that patients can less chance for an infection, less chance of having contact lens problems in general. So you want to take it, start it? What do you?
Well, I'm just amazed that the field has so much innovation in it. I mean, this past week we've had 2 different lenses come on the market. And I'm not sure if AI was involved in the production of this. He hinted at it, the representative from Johnson & Johnson, but I've already fit this lens. It's a lens for astigmatism, for distance lens, and for intermediate and for near, all in one package. And I fit 3 patients with it so far, but I suspect there's going to be more. So it's very exciting.
Well, just thinking of as you're saying that, I remember when I first started, years and years ago, we used to have patients that would ask, you'd be doing the exam and they would say, hey, I have astigmatism. And they would think just because they had astigmatism that they couldn't wear contact lenses, that would exclude them.
That's right.
So to go from that to now you're saying we can correct for the astigmatism and the multifocal component, and the contact lenses correct both, not just one, is we've come a little bit of ways.
Wow.
So,
We've come a long way. I remember going over to the wall and picking up a glass vial off of a little shelf on the wall that had the patient's prescription strength in it, and opening that lens and putting it on their eye. And then when we were done, taking the lens off their eye, cleaning it and putting it back in the vial, and using it for the next patient. And now we just go in and we've got hundreds of lenses with disposable options, and you can put it on and throw it away when you're done. So it's been a big change even just since I got out of school, how we fit.
I mean, modalities have changed. I mean, even when I was little, we had what we called conventional lenses at that point, where you may wear a lens 6 months, maybe even 12 months, where most of the contact lenses, most of the ones we fit nowadays, are either a monthly, you take it out at night, it lasts you 30 days. But, the daily options, there's been so many new dailies that have come out, like a daily disposable lens. And the reason for that is, I think we all agree that's the healthiest option, out there, less chance for infections, complications, and usually it helps patients who have extreme dryness and allergies and things like that.